This Focus on Health segment is brought to you by Aurora Healthcare.
Hello, I'm Jill Wunrow. Welcome to another Focus on Health segment. Today we look at a very important part of Aurora Medical Center here in Oshkosh, volunteers. Volunteers are there to greet you when you come in the door of the hospital and many times the last person you see before going home. Volunteers staff the gift shop, transport patients, and like I mentioned, they greet you when you come to the hospital and do many other functions to provide you a positive healthcare experience. Joining me now is John Nieman, Manager of Volunteer and Spiritual Services here at Aurora Medical Center. And John, you actually brought two volunteers along with you today. Why don't you introduce us to them?
Sure. I let them leave their posts so they could come and be in this
How
segment.
How generous of you.
This is Kay Bebo, and this is Christine Daly, two of my very active volunteers here at Aurora.
Okay, great. Thanks for joining us. And let's talk a little bit about volunteering in a hospital setting. Now, can anybody just walk in the door and volunteer their services that day, or kind of explain to me what the process is?
Sure. I know a lot of people do think that they can just walk in and volunteer, but they're actually, because we are a healthcare setting, we have certain rules to follow. So we do background checks, orientations where they have to go through quizzes. Sometimes it's a little scary when I say they have take-home quizzes to do, but we do quizzes and that too. So once we get them oriented and all that, then they can come in and volunteer.
Talk to me a little bit about the special training involved. I know you mentioned some of the quizzes and things like that, but working in the hospital and the clinic setting itself.
Yes. Well, Kay, for example, do you want to talk about the training that you had, especially because Kay works in the rehab VLCC unit, Vince Lombardi Cancer Clinic unit, and she does something special with chemo.
Tell us a little bit about that.
I volunteer in chemo, and I go in, I have a little red box, and I have to take it up to the hospital pharmacy.
Okay.
And I bring all the chemo treatments down to the cancer clinic.
So that red box is important.
Yes, it is.
Very important.
Because that way, the names on the bags, it's all in plastic bags, and they put it in there, and everything is private. You don't see anything.
So once again, she had some training. We didn't just give her the box and said, find the pharmacy.
The head nurse, Pat, took me up and showed me where I had to go and all that kind of stuff.
Okay. And how much time commitment do you expect from your volunteers?
And sometimes they think I work them a lot, but I'll let Chris talk about that.
Okay. We're expected to be able to volunteer at any time, whatever fits your schedule. And generally, we like to have 2 hours just so that you're kind of settled in and you get the job rolling. But any amount of time that you feel you want to volunteer, you can. And I volunteer in the gift shop, and I've been here half a year, and I've been trained. First thing I was trained on, obviously, is running the cash register. Then I was trained on some of the other administrative things you do. John gives a great list to follow every day, and we go through the list. Of course, if we can't get through all the items that are listed because of customers and that, he's very understanding. And after that, I guess you just continue to learn about what the gift shop entails, and that's helping the customers locate items that they were interested in, providing them direction, because a lot of times they don't know where to go in the hospital here. And basically that. We often wrap the gifts and basically sell anything we have.
And do a wonderful job.
Yeah.
You do a wonderful job at it, too.
What makes the volunteer experience at Aurora different than in other healthcare facilities?
Here, our volunteers are considered part of the care team. They're actually called caregivers. All of our staff here are called caregivers. So at some places where you go to volunteer, volunteers are given projects to do, set away from people. Here, I will not ever give my volunteers a project to do that I won't do myself, and I also do help them. But they're all caregivers, so they're all part of the team, and they're all treated like the staff here. I guess I always kid with them and tell them the only thing that they don't get is paid. But otherwise, they're considered with all the gifts that we give. We're going to be celebrating our 5th birthday in October, and they're going to be part of that inclusion with the gifts that we get and everything like that. Food plays a very important role here, too, so we always try to feed them, too. But that makes us a little different. It's a really part of the care team.
You mentioned they don't get paid, but they do get food, but what other benefits do they gain from experience? Maybe if you want to talk about that, and you can you girls can maybe talk about what you guys gained
Well,
personally.
you meet a lot of friendly people and make friends. And I also come from experience. My husband died here, but it was like everybody cares about everybody, not just the patient, but the family too. And that's what we have when we volunteer.
And that was her unique story. Is Kay was here in ICU with her husband, and she saw the care that her husband got, but also that her family got, and she decided that's what she wanted to do, was to give back. And of course, it on her own time, because
Right.
she needed time to grieve and get on with the basics of life. But when she had that done, she got it done, and she's been here 3.5 years.
Oh, thank you.
And she's here 3 days a week, so a big time
Okay.
commitment.
Okay, and Chris, how about you?
I have my primary physician here, and I've been seeing him for 12 years, and I just really like Aurora. And they have a philosophy here where we help the patients and the visitors that I really like and enjoy. We basically, if someone needs something, we go out of our way to help them. For example, if someone needs to have them be shown the directions throughout the hospital, we actually walk with them to get them to where they need to be. We could just give them directions and have them go down the hallway, but people often get misguided that way too. So we actually just walk with them all the way to the destination. So.
John, maybe could you talk a little bit about who is actually eligible to volunteer?
Sure. Actually, here for youth, a lot of churches in their confirmation classes are requiring volunteering now. High schools are, and colleges. So here it's age 15 on up can volunteer, and we actually do have quite a few teens. Also, we're seeing an uprising now with families wanting to volunteer. So we have mother and son teams, brother and sister teams here, which is really, really cool.
Awesome. And now I think I have a guess, but what is your Knitters Noon and who benefits from it?
Actually, that is a really neat program where we have volunteers, and they're not on site here, so they're at home and they're knitting and crocheting for our patients here. It's a cool experience. When I first started here, they said the nurse came down and said we need hats for the newborns, and I was very naive. And I thought maybe 3 births a month. Well, we average between 65 and 75 births a month.
Okay.
And so I went out to a local store and asked them if they would donate the yarn. I got the patterns, and I know way more about knitting than I ever want to know in my entire life.
I was going to say, how are the guys doing at
I
knitting?
know. It's like I know that there's a difference between knitting and crocheting now and all of this other stuff, but we supply the patterns, and our knitters will knit the hats for the newborns. They knit the Go Packers hats. They also knit, we had one family where the father was a Bears fan, and they knit a special hat for him. They knit the booties, they knit blankets.
Aww.
They also knit full-size Afghans for cancer, dialysis, and radiation patients here. So every patient who's in those programs gets a full-size Afghan.
Oh, that's awesome.
Plus, we also knit prayer shawls. So they're a very active group. Anyone can be part of the Knitters Nook. All they have to do is come into the gift shop, grab the yarn and patterns, and away they go.
Awesome. Thank you very much. And how do your volunteers also reach out into our community through volunteering?
I'm going to let Kay take that one because she's a perfect example of anytime I have a need, I always go to Kay because, as you can tell, Kay is very social. So I'm going to have her talk about 2 of the community outreach things that she does here at Aurora.
Well, I do the Explorer group from the West High School, and they come, well, they'll start in November, once a month. They come and they go to different areas we take them.
To learn more about the healthcare field,
Okay.
and she does the tours.
Yeah, and I do the tours, and they ask questions and all that kind of stuff.
So
And
you're a tour guide too.
Yes,
Yes,
she
I
is.
am.
So she knows the place pretty well. And then she also goes out into the community with another program.
The flu, I also help with the flu shots.
Oh.
And when we do the flu shots, now they will start in October. So we go like to schools and different areas and do that.
Awesome. So you're quite busy.
Yes, I am. Also, I volunteer at my church too.
So thank you so much for all your hard work you do here at Aurora. And John, is there anything else that I'm missing that you want to talk about?
Well, I just wanted to thank you for this opportunity too, because our volunteer program here is very active, but the one thing, like Chris said so well too, is I let the volunteers set their schedules here. I realize how busy families are today, and so the volunteers set their schedules when they want to volunteer and how long they want to volunteer, and I try to make it as easy as possible, and I invite people to come and join our wonderful group of volunteers.
And don't forget, you get food sometimes.
Yes, you do. That's the biggest thing. Always, yep, very good. You caught on quickly.
Volunteering is a great way to help others here in Oshkosh. If you would like to volunteer or would like more information on volunteering here at Aurora Medical Center, please feel free to give us a call at 456-7013. Thanks for joining us for another Focus on Health segment. I'm Jill Wunrow. Have a great day.
This Focus on Health segment has been brought to you by Aurora Healthcare.